Hi, I'm Michael Lambert, a fellow in social inequalities at Lancaster University. And today I'm talking about researching inequalities with another one of our centre members. And so can I begin by asking, who are you? Who am I speaking with?
I'm Adam Mars. I'm a third year now PhD student based at Lancaster University in the Division of Health Research. My PhD is funded by the National Institute of Health Research, School of Public Health Research. I'm currently in my final year.
And so what is it that you do then? What's your research?
Yeah, great. So my research deals with two themes, I would say. On the supply side of the research, I'm looking at the policy of social prescribing, which is a policy agenda that's emerged out of the broader personalised care agenda and the movements in recent times within the NHS to provide a more responsive service and offering for patients. Famously, in my research, I often refer to a quote by Tony Blair that discusses moving away from getting what you're given to something that you want, offering the patient more choice, a more personalised, bespoke offering. And on the demand side, if you like, of the research, I'm looking at men in the north of England, traditionally underrepresented in primary care consultations. And so the two strands intersect, looking at if this reform to policy offering a more personalised agenda can help reach out to men that are often underserved or self-select to not attend primary care consultations.
So I've got a real sense of the place of social prescribing as a policy agenda and how that's sort of not implemented, but understood and appreciated by those that it concerns. But how do you go about doing what you do? What are the kind of research methods and forms of analysis you use to get under the skin of this issue?
Yeah, so initially I wanted to do some participant observation or some ethnographic stuff. Yeah. And of course, with the COVID-19 period of social isolation, this was prohibited basically, and so the research design had to adjust. I then transitioned to semi-structured interviews, largely over the telephone, with 2/3 of them undertaken during the lockdown period. 15 men who've passed through social prescribing programs, interviewed twice, and around 12, I think, linked workers who are the main role responsible for delivering and connecting patients with a social prescribing offering in the surrounding community. And most of this was done over the telephone, and I think it was as long as I made sure that to be sort of inclusive with the sample that I was after, and that I was getting at the right sort of demographic that I was interested in. It worked out quite well. I felt that the men responded quite well. They felt like they had a lot of control over the telephone. It didn't feel alienating. So I think it went reasonably well.
So given that you're kind of looking at this policy agenda and then its ramifications through both the people who are responsible for implementing and doing it and the people that are kind of going through these processes, what is the relationship of this research to inequalities? Because they get a really sort of a sense of how it kind of fits in, but where do you see inequalities fitting within this?
Great question. I'm dealing with literature from broadly speaking, the field of health inequalities. And so, of course, widening income distributions from the 1980s and neoliberalism's ascendancy are a part of the story. Of course, this has been, especially in the North, further exacerbated by two other social processes, along with neoliberalism: deindustrialization and austerity. And I think in terms of where inequalities fits in to my research, I'm interested in the connecting the sort of macro picture of this rather dismal, pessimistic view that inequalities are seemingly becoming wider. We're living in what Thomas Piketty calls techno-feudalistic times, with the sort of meso-micro level of how communities are still managing to find hope and move towards effective, emotionally engaging practices, whether that's through social prescribing or earlier on in the life course, that help at least ameliorate some of the weight of social suffering under these intense inequalities that seem pervasive.
One of the, I suppose, really interesting things from my point of view that I've heard you speak on before is the way that you're trying to, I suppose, bridge the disciplinary gap almost. And I find that really, really exciting from an inequalities perspective, because you mentioned that you're kind of allied to this traditional health inequalities approach, is kind of the outcomes, the population dynamics, but also that you're kind of intellectually engaged with a lot of this idea and language about class, in particular, in identifying, working class men as a constituent to understand in terms of social prescribing, and blending those together through this empirical case study in community as well. I think is very, very exciting in trying to show the value both of applied research to traditionally kind of theoretical perspectives, but also then bring that theory and that kind of embedded understanding into the health inequality perspective. And I think there's a really strong contribution to make from the kind of work that you do there.
Yeah, thank you. I think that's certainly been at the forefront of my, it's an emerging priority of the research, I think, to get fields that seemingly talk past one another, to connect them up. And I also think, although I'm largely critical of a movement referred to as well-being studies or positive psychology, there is, in recent sociological writings, there is a sort of readjustment away from this rather bleak strategic actor, follows the self-interest strategically, to a working class that, and it reconnects with older studies in the field, D.P. Thompson, Raymond Williams, but that cares about life projects, that isn't merely just overly socialized into neoliberal norms or parroting masculine norms about mental health, but that there's something else going on here. And so that's another part of the field. Talking with one another is not uncritically looking at this literature on well-being that's often rather naively optimistic and doesn't contain a structural critique of inequality, but taking elements of that about well-being and positive emotion even, and reworking it through conventional sociological theories on inequality.
No, that's a really good way of putting it, in a way of kind of seeing the virtues of such an approach, almost kind of in spite of the critique
yes, yeah,
on them. So Can I ask then, beyond the research that you do, if there are any kind of partners, stakeholders, or other organisations that you're working with, either as part of your research or part of your wider kind of commitment to undertaking work around inequalities?
Yes. Well, I've been very lucky to feed back some of the research to a number of partners across the Merseyside area that are doing, against tremendous constraints, are doing reasonably good work in social prescribing, and have been very generous with their time with me. A lot of the men that I've interviewed, I've fed back to either virtually or over the telephone, just in keeping in check with the validity of the analysis. The social prescribing network has been a sort of sounding board for some elements of the non-critical factual parts of the thesis, if you like.
Yeah.
And yeah, I think that's it for now, off the top of my head. The National Institute of Health Research, who funds the PhD study, has been a tremendous source of training and stimulation. My supervisors, Paula Holland and Andy Harding, have been, great sounding boards as well. So, yeah, it's been a very collaborative period of research.
No, that's excellent. I think, again, that's a real showcase of both the doing and the realizing research, that rather than it being kind of this top-down imposed understanding, that sort of from the design right through to the process, you're very much kind of working with people and that bottom up in mind. And it really comes across both in how you talk about your research, but also how you then describe where its value lies and what its kind of meaning and significance is as well.
Yes. Yeah. Thank you, Michael.
And it's been fantastic talking to you, and thanks for taking the time to speak about your research and its relationship to inequalities.
Pleasure. Thank you.
Thanks very much.